There's a lot of buzz around medical cannabis right now, but is it really safe? Today we're going to talk about ways we can reduce risks if you are taking medical cannabis. I'm Dr. Ammon Hills. I'm a pain management physician. I practice in northern Utah, and I take care of a lot of patients in chronic pain. And lately have had a lot of questions about medical cannabis, if this may be something right for them. Today, I'm going to share with you 10 ways to help reduce risks associated with cannabis use, whether medical or non-medical. Cannabis has been shown to be beneficial for certain health conditions and now is legal in many states, but there still are some associated health risks that you should be aware of. So hopefully this will help you make a more informed choice for using this safely. Number 1, delay use of cannabis later in life. So we're talking into adulthood if possible. The reason is if you're using it at a younger age, this puts you at a higher risk of some of these adverse side effects from cannabis. Number 2, avoid use of cannabis if you are pregnant or if you have a family history of someone who may have a substance use disorder or mental health disorder such as psychosis. Number 3, with many medications, we start off with a lower dose and then we'll gradually increase the dose. This is to help reduce the risks of any side effects from that medication. The same thing holds true for medical cannabis, where you should start at lower doses and also look at the concentration of what you're getting. What I mean by that is getting products that are lower in the THC component and higher in the CBD component, at least initially. Number 4, stay away from synthetic cannabis options such as K2 or Spice. These are very potent formulations of cannabis and are more likely to put you at increased risks of having a bad reaction from the cannabis. With cannabis, there's a lot of different ways to ingest it or take it into the body. And so there's less risky ways than smoking, such as tablet, capsule, concentrated oil, liquid suspension, transdermal preparation, or even blister packs. Some people will use a wax or resin and use this in a vape formula to bring the cannabis through their lungs. You should know that the CDC recommends against this just because vaping, there have been cases with vaping that have been associated with acute respiratory failure, interstitial pneumonitis, among other lung problems. Also, it's discouraged to use cannabis in brownies or cookies just because this may be confused for other people who are not intending to ingest the cannabis, and have been cases of like young children who have incidentally or accidentally ingested, this controlled substance. Number 6, if you do choose to smoke cannabis, avoid breath holding or deep inhalation. Number 7, how frequently should you be taking cannabis? Those people who are taking cannabis daily are at higher risk for adverse reactions and also for other things like addiction or mental health disorders or cannabis use disorder. Number 8, don't operate a vehicle or heavy machinery 6 to 8 hours after taking cannabis. The reason is you may be slightly impaired from taking cannabis. Remember that taking cannabis with alcohol has a synergistic effect, meaning you may be more impaired and have delayed reactions and higher risk for fatal motor vehicle crashes. Number 9, your actions add up. The more risk you take, the more likely you are to harm your health. So whether you're taking cannabis or any other medication, just know that there's risks associated with that decision. Number 10, not using cannabis at all is still the best way to protect your health unless you have a qualified medical condition and are being treated by a supervised medical provider. Most importantly, don't hesitate to seek help from a medical professional if you need help controlling your use of medical cannabis, if you're experiencing withdrawal symptoms, or if it's just affecting the function in your life. If you have any questions about cannabis, please leave those below. I'd be happy to answer those for you. If you want more videos about cannabis, check out this other video right here. Thanks for joining me. I'll see you guys next time.